Now let us try to understand the blood picture or the peripheral smear. Like you draw blood from a patient and then see it under the microscope. So first thing you observe, there are multiple nucleated RBCs because because the demand for RBC has increased so much, so the bone is not able to produce matured cells directly. So what happens is it starts producing immature cells that have nucleus in them. Normally nucleus is absent by the time it reaches the blood. Apart from that, you also find many different shaped cells like target cells, and then you can find these cells which have like irregular border and quite hypochromic, means the color is also reduced. So that there is different shapes, so it's called anisopoikilocytosis, and that is a finding on your blood test that will tell you that yeah, this patient has a severe thalassemia. The next point, we can do a test called as Nestrov test. The Nestrov stands for Naked Eye Single Tube RBC Osmotic Fragility Test. As such, in thalassaemic patients, there is decreased osmotic fragility. Means when you put the RBCs on a dilute solution, even if RBCs take up more water, they will not burst like a balloon, right? So thalassemia will have mainly the alpha 4 type or alpha 2 gamma 2, and these cells are quite resistant to bursting. So this is normal. The normal cells are not so resistant and eventually burst, and you can see the lines behind them. But here the cells are there. When the cells are there, you cannot see the lines behind them. Apart from that, let us talk about the blood picture. So we do a test which is gold standard, that is high performance liquid chromatography. It will tell you the hemoglobin that is present in that RBC, right? It will show you that HbF, that is alpha 2 gamma 2, that is it is more than 90% in this patient. And it will also tell you that HbA is not there, the adult form is not there. The HbA2 is more than 3.5%, and that is there in case of thalassemia minor, right? So basically in thalassemia major you only find HbF, and you might find the alpha tetramers as well. Next, like how do you differentiate whether it is iron deficiency anemia or is it thalassemia major? Major things to note is the Menser's index being less than